Hello everyone. So let's have a look at the first question. This says if VQ ratio approaches infinity. Please understand this question is not saying that the VQ ratio is equal to infinity. It is saying it is approaching infinity. That means the VQ ratio is very, very high, right? Now, when do you get a VQ ratio equal to infinity? This is going to be seen when the perfusion is 0. Then the VQ ratio is equal to infinity. That means if you look at this diagram here, this is the alveolus, here is the pulmonary capillary. If blood flow through the pulmonary capillary is completely obstructed, there is zero blood flow, then the VQ ratio will be equal to infinity. Now, when it says approaching infinity, that basically means that now the VQ ratio is very, very high. And how do I get a very high VQ ratio? That means the perfusion is very less as compared to the ventilation. Right? That means there must be some sort of a thrombus which is partially obstructing the blood vessel. So in this case, what is going to happen is, now the ventilation is much, much more than the perfusion. So this very little blood flow will be very well oxygenated. That means it will have a very high PO2 and a low PCO2. Ventilation is much better than the perfusion. So this is my answer, right? If the VQ ratio is equal to infinity, then no O2 is absorbed and no CO2 is released. That means there is no blood flow, right? Then even the second option would have been correct. Pulmonary artery obstruction. These are both going to be seen when the VQ ratio is equal to infinity. So the answer here is D. The next question, what is the duration of the nodal delay? The duration of the nodal delay is 92 milliseconds, or we can write it as 0.092 seconds or 0.09 seconds, right? Now, sometimes you are given an option that the nodal delay is 0.7. You may be given a question where the options could be, it is 0.09 or is it 0.10 seconds, right? Even then, I would prefer 0.09 second because, like I said, it is 92 milliseconds. Yes, if 0.09 was not there and 0.10 means it is 100 milliseconds. Right? So in that case, if 0.09 was not there in the options, and let's say you had an option of 0.1, 0.2, 0.3, 0.4, then I would have gone for 0.1. So keep in mind, what is a millisecond? 1,000th of a second. Now, why is there a nodal delay? This was an INI set question. The nodal delay is because the AV node fibers, these are small diameter, and because they are small diameter, they will be slowly conducting, and they also have very few gap junctions. What is the advantage of the nodal delay? Advantage of the nodal delay is that all the 4 chambers of the heart do not contract at the same time. The atria will contract ahead of the ventricles. And you know that the atrial contraction is responsible for the last part of the ventricular filling. Let's look at the next question. The carotid sinus nerve is sectioned in an experimental animal. So what is this carotid sinus nerve? You know the baroreceptors are carotid sinus and aortic arch. So from the carotid sinus, there is a small nerve which is called the carotid sinus nerve, and this joins the 9th nerve or the glossopharyngeal, and the impulses go to the medulla. Now, we have discussed this yesterday, that more the firing rate of the baroreceptors, less the sympathetic outflow. I told you the effect on sympathetic is ulta, isn't it? More the firing rate, less the sympathetic discharge. Now, if I section the carotid sinus, that means there are no impulses reaching the medulla. That means less firing rate. Yes? Why less firing rate? Because the impulses are not reaching the medulla. So sympathetic outflow increases. So what will happen? Immediately after the section, there is an increase in heart rate and increase in blood pressure. Once again, more the firing rate of the baroreceptors, less the sympathetic outflow, less the firing rate, more the sympathetic outflow. By sectioning the carotid sinus nerve, I have reduced the number of impulses reaching the medulla, so sympathetic outflow will increase. So increase in heart rate and blood pressure. A premature infant develops respiratory distress soon after birth. Arterial blood gas analysis reveals hypoxemia, chest x-ray, diffuse ground glass opacities, hyaline membrane disease, and this is because of a surfactant deficiency. Surfactant is produced by type 1 or type 2 pneumocytes. These are produced by type 2 pneumocytes. And what is the role of surfactant? To decrease the surface tension. If there is a surfactant deficiency, it causes a high surface tension and there is a tendency of the alveoli to collapse. Cardiac output increases in all of the following except exercise, definitely. In exercise, there is almost a 400 to 500% increase, 4 to 5 times increase in cardiac output. Anxiety, cardiac output can become double, twice, 200% increase. Eating can increase the cardiac output by almost 30%. But when you go from supine to standing position, there is going to be, because of the effect of gravity, there is an increase in the peripheral pooling of blood, and this will decrease the venous return, and therefore it will decrease the cardiac output. So the answer becomes supine to standing.